By following these secret tips, you can have a healthier relationship. 1. Human immunodeficiency virus. HIV transmission without clear symptoms. HIV is primarily transmitted through sexual contact, sharing needles, and from mother to child during pregnancy, childbirth, or breastfeeding. However, one thing that many people don't realize is that many individuals infected with HIV may show no symptoms at all. In fact, during the early stages, symptoms like fever, sore throat, and fatigue can be mild and easily mistaken for common cold or flu symptoms. This can lead to people, especially those at higher risk, not realizing they have HIV and unknowingly transmitting it to others. Window period and the importance of HIV testing. Another aspect that people are often unaware of is the window period. This is the period after contracting HIV when standard HIV tests may still fail to detect the virus. During this time, an individual can still transmit the virus to others, even if they are not yet aware they are infected. Therefore, regular HIV testing, even in the absence of symptoms, is crucial for people at risk. Slow progression of HIV with proper treatment. While HIV can eventually progress to AIDS-acquired immunodeficiency syndrome, fortunately, with advances in science, antiretroviral drugs ART allow those infected with HIV to live long, healthy lives. In fact, if treatment begins early, HIV can be controlled, and the disease progression to AIDS can be significantly slowed or even halted. ART aims to reduce the viral load to the point where the virus is undetectable in the blood, meaning a person may still have HIV, but they are no longer capable of transmitting it to others. PrEP pre-exposure prophylaxis medication. For individuals at high risk, such as those with a partner infected with HIV, the PrEP pre-exposure prophylaxis medication can effectively prevent HIV infection. These medications should be taken under medical supervision and are especially effective for individuals who are at a high risk of contracting HIV. HIV treatment. Currently, there is no cure for HIV, but antiretroviral drugs ART can effectively control the virus and prevent progression to AIDS. These medications must be taken regularly and under medical supervision. ART helps reduce viral load and maintain immune system health, allowing those infected to live longer and healthier lives. 2. Human papillomavirus. Different types of HPV and their risks. HPV is one of the most common sexually transmitted viruses, with over 100 different types. Only a few types of HPV, like HPV 16 and 18, can lead to cancer, particularly cervical cancer. Other types of the virus may cause genital warts, which, while not typically painful, can cause discomfort. What many people don't realize is that most individuals with HPV show no symptoms and may unknowingly transmit the virus for years. HPV and other rare cancers. HPV is most commonly associated with cervical cancer, but it can also cause other cancers, such as anal, throat, and head and neck cancers. Research shows that throat cancer, in particular, is on the rise, especially in men. This is often due to a lack of awareness about this link, and it highlights the need for better public awareness of HPV's broader impact. HPV vaccine Gardasil. One of the biggest advancements in the fight against HPV is the introduction of vaccines like Gardasil. These vaccines can prevent infection with high-risk types of HPV, ultimately reducing the incidence of HPV-related cancers. Vaccination is especially recommended for teenagers before they become sexually active, as the vaccine is most effective when given before exposure to the virus. However, even adults can benefit from the vaccine and reduce their risk of HPV-related cancers. HPV and its ability to resolve on its own. Interestingly, in many cases, the body can clear HPV on its own. Most people who become infected with HPV will not develop any issues, and the virus will naturally be cleared from the body. However, in some cases, the virus can cause cellular changes in the genital area or cervix that, if left untreated, may lead to cancer. This is why regular screenings like pap smears for women and awareness of symptoms for men are important. HPV treatment. Currently, there is no cure for HPV itself. However, if HPV leads to problems such as genital warts or cellular changes in the cervix, various treatments are available. Genital warts are typically treated with topical medications or medical procedures such as cryotherapy, freezing, laser treatment, or surgical removal. In cases where HPV causes precancerous cellular changes, additional treatments such as colposcopy, examination of the cervix, and biopsy may be needed. HPV in men and its effects. Men, just like women, are at risk of HPV, but they are often less aware of it. While cervical cancer primarily affects women, men can also develop cancers such as anal, penile, or throat cancer due to HPV. Because men are less likely to undergo regular screenings, early detection can be more challenging. This underscores the need for increased awareness of HPV risks for both genders. Preventive and treatment measures for HIV and HPV. 1. For HIV prevention and treatment. Prevention. Using condoms in all sexual encounters is one of the most important methods to prevent the transmission of HIV. Testing. Regular HIV testing is recommended for people at risk, even if no symptoms are present. PrEP. Using PrEP medications for individuals at high risk of HIV can significantly reduce the likelihood of infection. Treatment. ART, antiretroviral therapy, can control HIV and prevent progression to AIDS. These medications should be taken regularly under medical supervision. 2. For HPV prevention and treatment. Vaccination. The HPV vaccine is one of the best ways to prevent HPV-related cancers. It is recommended before individuals become sexually active. Prevention with condoms. Using condoms can reduce the risk of HPV transmission, though it does not completely eliminate the risk. Treatment. If HPV leads to genital warts or cellular changes in the cervix, treatments like topical medications, cryotherapy, or surgical removal may be needed.